Sciatica truly sucks. I want to provide something that actually will give you relief and help you actually heal and get rid of your sciatic pain once and for all. So tune into this video and we're going to talk about how your pelvic floor is really important in allowing your sciatic nerve to heal. So sciatica, the definition of sciatica, is just irritation or pain to the sciatic nerve. You often don't know about this condition until you are brought down by sciatica. It is not comfortable. It causes an achy butt cheek, an achy leg. It can prevent you from sleeping. It can prevent you from living your daily life, and even just like simple things like getting on and off the floor or getting up out of bed. It can really rock your world. People that deal with sciatica for many years often have a lot of compensations and end up getting one leg weaker than the other because of the fact that their sciatic nerve starts to not fire as well to those muscles. And then those muscles on that leg actually get weaker, physically weaker. And so I want to talk about how to actually start to heal your sciatic nerve through your pelvic floor and why they're so related. Most people who have had sciatic pain, you'll go to a chiropractor, an acupuncturist, a physical therapist. You might even have cortisone injections to help reduce the pain on that sciatic nerve. Well, sciatica can come from multiple places. It can either come from your low back, come from the nerve roots in the low back being compressed by maybe a disc or compressed by a joint that doesn't move as well in the spine, or it can be compressed by some of the muscles that leave the spine that attach to the sacrum and come out to the hip. So some of those muscles, one being the piriformis, can compress the sciatic nerve and then cause irritation down into the entire leg or into the butt cheek. And it is very uncomfortable. And so I'm glad you're tuning into this video because I want to talk about how important it is to help the pelvic floor work normally, because that can help heal your sciatic nerve symptoms. So how we typically treat sciatic nerve pain is we want to make sure we free up the nerves where they're getting irritated. So if they're getting irritated in the glutes or by the buttocks, mainly that piriformis muscle, then we want to release and balance them. So this is the back side of the butt and the nerve is going to come out through here. And so if it's being compressed right here, we want to help prevent that compression and we'll balance the muscles on both sides of the butt. And so that might look like you've done some glute stretching. It might be that you do some hip flexor stretching to help balance the muscles on the outside of the pelvis, which is going to allow the nerves to flow and travel without being compressed on either side. Sometimes we have rotations in our pelvis of the sacrum or of the ilia, they're called, these little hip bones. And if that happens, that can also increase the compression on the nerve. And so we got to work on balancing those hip bones. And then if the nerve is being compressed somewhere in the lumbar spine, we have to free it up in the lumbar spine. So that's normally what you'll get when you go to a physical therapist who is very cognizant and aware in treating sciatic pain and can help you with your sciatic pain. However, what is missed so frequently, and the reason we see people that have been dealing with sciatic pain for so many years, is they maybe get some relief for about 3 to 6 months, and they'll have like good days and bad days with their sciatica, but then they don't get true relief that leaves their body forever. A lot of this is because they never actually treat the pelvic floor. So have you heard of the pelvic floor? Please drop in the comments if you've heard about it, because I love knowing if people have even heard about the pelvic floor. It's such an important part of our bodies that we are usually like pretty disconnected to. And the pelvic floor is just so important in taking pressure off the sciatic nerve and allowing there to be balance in the pelvis so that you don't have pain in one butt cheek or another butt cheek, or so you don't compress the nerve that is going to shoot pain all the way down the leg. So we got to balance the pelvic floor muscles so that they take the pressure off of those nerves and that you don't have pain on one side of your body or the other side. So what is the pelvic floor? I'm talking about it and you're like, I've never heard about this. It's 3 layers of muscles and tissues that are at the very bottom of our pelvis, okay? So if the sciatic nerve comes out through here, the pelvic floor is at the very bottom of the pelvis. Well, what we see is that people who have back pain or sciatica often have really tight pelvic floors. So these muscles tend to brace and tighten to try and support the nerve when we feel or experience pain like sciatica. These muscles tighten tremendously, or if you have excruciating back pain, these muscles are going to tighten to protect that pain. But it actually does us a disservice because that's a compensation that then that tightness doesn't let go and it just keeps holding tight. Well, what happens is that if it's tight on the inside, it can pull on the sacrum one way or another. It can create more dysfunction in the nerve roots that are coming out from the spine, creating the sciatica to be worse, or not letting that nerve fully heal. And so we have to help that nerve fully heal by helping open up the pelvic floor and relax the pelvic floor. You might be saying, well, I did Kegels to heal my sciatica, or my physical therapist gave me Kegels as one of the tools to help heal the sciatica. Well, most of the time, we actually need to be doing the reverse. So like a reverse Kegel, or what we would call a relaxation of the pelvic floor muscles. And if you've heard of the term Kegel, it just means that you're contracting the pelvic floor, like you squeeze, like you're trying to stop the flow of urine, and then you let it go, and then you squeeze like you're trying to stop the flow of urine, then you let it go. That's a Kegel. We don't want to be doing that if we have sciatic pain. If we have sciatic pain, we want to be working on opening the pelvic floor, because the more we can open these muscles, the more it's going to help open and release those nerve roots and not put abnormal and bad tension on those nerve roots. So tune into that, like follow along here. And if you haven't followed along, like go and re-watch this. But at the end, I'm going to give you an exercise to start opening up and relaxing your pelvic floor. And this will help take some of that pressure off that sciatic nerve. But once we'll get there, but I need to kind of walk you through how this pelvic floor is related to the sciatic pain and dysfunction that you're experiencing, and why it's probably not leaving your body, or you got a cortisone injection, but then it still came back. The cortisone doesn't solve any of the dysfunctions of why that nerve keeps getting irritated. And essentially with sciatica, we have to find out, why is that sciatic nerve continually irritated? Is it what you're doing in your daily life? Maybe is one leg stronger than the other, and then all of these muscles on one side of your body are pulling that sacrum and are stronger on one side of the body than the other. We need to figure that out. And once we figure that out, we can establish balance in these muscles on the outside, but we can also establish muscle balance on the inside. A lot of times people will have been strengthening or getting core stability to help heal the sciatica. And while this is absolutely essential in healing the sciatica, we also have to make sure that we are fixing the compensatory problem. So if you are being told to do Kegels to give you that stability, or what a lot of people do is just do the Kegels and actually forget about the lower abdominals that are so important in providing that front stability. So we're going to go through all these aspects of the core that have to be turned on, but most of the time people don't need to be doing Kegels if they have sciatic pain. For that, we need to work on relaxation and opening, and then strengthen the muscles through the other core muscles. I'm going to just explain the core, and I want you to use this diagram to see what the core is. The front of the muscle, the front of the core is called your transverse abdominis. I want you to look at this picture and see it here. The transverse abdominis goes across the belly on the front of your body. On the back of your body, you have the glutes. So look at the glutes here. That is part of the core. On the bottom part of the core, we have our pelvic floor muscles. On the top part of the core, we have our diaphragm muscles. And of course, you're gonna have your six-pack ab muscles on the front. That's called your rectus abdominis muscles. And then you also have your lats and your lower traps, and those are gonna come and connect down on your back. I hope you can see in this picture here. And then when we're looking at all these facets of the core, it's really important that the front muscles and the back muscles are really strong. It's also really important that the top muscles and the bottom muscles are really strong. However, they have to have movement. So if the top and bottom muscles don't have movement and can't open and recoil, then we lose some of our shock absorption abilities of the pelvis. And when we walk or do anything, that absorption is going to go into our joints, and that absorption isn't going to be assisted by our core, because the diaphragm and the pelvic floor need to go up and down and move in relation to our foot hitting the ground. And that movement is helpful for shock absorption. And it's a key element of what our core muscles should be doing. And so you have your front and your back muscles, and then you have your top and your bottom muscles. And now if you've been working only to strengthen and squeeze the bottom muscles, you continue to have your sciatic pain because maybe your sacrum is twisted and that's irritating the sciatic nerve. And so we want to help release those muscles on the inside of the pelvis, which I'm going to show you here. And if we can release those muscles on the inside of the pelvis, the way that the nerves come off of these inside of the pelvis muscles, they can be relieved because you're relieving the tightness of these really deep third layer pelvic floor muscles. So this very third layer of the pelvic floor can be a big reason why sciatic pain persists. So we need to release these muscles and balance these muscles so they have range of motion, so we aren't continually irritating our sciatic nerve. How do you do this? Typically, you want to work with a pelvic expert physical therapist who has very skilled with their internal manual therapy in order to help open up and stretch these muscles, and then find any scar tissue or adhesions that might be on these muscles, or that could be limiting how the nerves are exiting the pelvis. So that would be my first thing, find a pelvic expert physical therapist. The second thing I want to tell you is you can start stretching these muscles by yourself. You just have to get connected to them. And that is one of the hardest things to do, is get your mind connected to controlling these pelvic floor muscles. So the muscles themselves contract, they relax, and then they overstretch. If they contract and then they relax and they overstretch, if you've been used to doing Kegels or contracting, you're only working in this range of motion. And so we have to get our motion in our pelvic floors to go in this direction. All right, most people, again, who have back pain or sciatica have this tightened or over-shortened pelvic floor. So the very first thing we can do to start generating some range of motion here without irritating the sciatic nerve further is to do some deep breathing. Now, in order to feel this breath pattern, I'm going to ask you to do some movements. So if you have a vagina, your vagina is going to contract if you squeeze your pelvic floor, and it's going to relax if you relax your pelvic floor, and then it can open if you bear down like you're trying to fart. Those are the three movements of the pelvic floor. The other movement that you can get that opening and the bearing down of is just by breathing. So if you take a nice belly breath into your belly, so if we breathe in, we want the air to go into our belly, so the hand on my stomach. If you breathe in up here, if you breathe in here, you're going to see my chest rise, and then exhale. We don't want the air going there. We're going to focus on the air going into our hand on our belly. So let your belly be soft. Inhale, the air all goes into your belly here. Inhale again. The belly is expanding. Exhale, you get some recoil. Now I want you to tune down to your vagina or your vulva. And I want you to think, when you inhale, can you imagine your vagina opening or your pelvic floor opening? Exhale, you're going to feel some natural recoil. Inhale and open. Exhale and let the recoil happen. Now, if you imagine that your vagina is a rosebud, and with the inhale, we are trying to blossom the vagina to turn into a full-fledged flower so we can see all the petals of the flower. And then exhale, you're going to get some recoil of that flower. It's going to turn into the bud again. Then we are going to blossom the flower with our inhale. And then exhale, let there be some recoil. That is the motion and the range of motion that you want to feel from your pelvic floor. If this is hard and you're like, I can't feel this at all, what you want to do is, you could do this in the privacy of your home, is you could place a finger right on the vulva. So you can just put your hand right on the vulva, or you can place your finger right inside the vagina and see if you can start to feel that movement of opening. And once you start to get that movement of opening, you want to use this breath pattern to help give you that stretch and that opening of the pelvic floor. And that is going to start to help heal the true cause of what can be hanging up that sciatic nerve. So get the range of motion of your pelvic floor, get some work done on your pelvic floor, and that is going to change the game for your sciatic pain. And most of the time, people are so fed up with the sciatic pain that they just want it gone for good. This is one of the key elements for making sure that you don't have sciatica for the rest of your life and you don't have good days and bad days. We want all those days to be good days. And so we have to get to the root cause of the sciatic pain, and we have to start addressing all the muscles that affect the mechanics in your daily movement patterns. And if we're not addressing the pelvic floor, then you're not going to be able to fully heal that sciatic nerve pain or that sciatica that you've been experiencing for years. So I hope you enjoyed this, and please like and subscribe and share this to your friends, because we want to help make sure that no mom is living with sciatica, no woman is living with sciatica, and we want you to live these healthy, happy lives where you can get good rest at night and you can do all the activities you want to do during the day. There's no other way to live. So I hope you enjoyed this. I hope this was helpful. Please shoot us a message if you have any questions or you want further help and guidance on this, and we are happy to give you that. Take care.